God.
Okay, so the meeting is now live on the YouTube. So as we were discussing that today we are going to be doing the assessment. And in the assessment, I think yesterday we had already discussed that there are basically 4 type of scenarios which can be there in the assessment. 2 are the in-hospital scenario and 2 we can say as a community scenario. The in-hospital scenario are the news and the GCS. As you can make out in the news, the type of scenarios that you can get is like someone coming with acute problem, such as someone might come with acute attack of asthma, someone with a pneumonia, someone might come with like an ectopic pregnancy, or so these are all like a news sort of scenario, but someone comes with a fall and had a head injury, or it is a subarachnoid hemorrhage, something like that, they will be going for the GCS kind of scenario. So these are going to be for your the in-hospital scenarios. And then we have the community scenario. So in the community scenario, there are 2 type of scenarios that we get. And also we need to understand that when we say community, it does not always mean that it is going to be the patient's home. So it is anything which is outside the acute hospital becomes the community. So sometimes the care homes, nursing homes, residential homes, these are also part of the community. So you would have seen that some of you might also be working in these settings, but you will see that when the patients are over there, they do not require acute care, but there are still some medical problems which are ongoing. There are still some medical needs which are there, which you are going to be catering for. So when we say that the community scenario, what we are expecting, or the 2 type of scenario that we are doing, are the must scenario, which is the malnourishment assessment scenario. And the other one is the PHQ-9, which checks the mental health of the patient, that how the patient's mood have been, whether they are depressed or whether they are at a risk of depression. And if they are depressed, then what is the severity of the depression and all. So but when you are doing the community scenario, in that, because we also require to show in the exam, and we also require to know how to take the vital signs of the patient, you will also be required to complete a news chart. So when we do community, you are going to be filling a news chart, as well as there is going to be a completed must or a PHQ chart that will be provided to you. And the history will say such that, okay, the patient has already had a must assessment done, and this is the result of that one. Now the result is going to be like a partial kind of a result, that they are going to be partially fill it, that the BMI is slightly on a lower side, or the percentage of weight loss is slightly on a lower side. So your score can become, you will have to add the score. So they will be circling the points where they are thinking that whether your the BMI is falling between 0, 1 or 2, or your the percentage of weight loss is falling between 0, 1 and 2. And then you will have to combine that score, and you will have to say what the score is. Like your score can be either 0 or 1 or 2. Now, depending upon what your score is, then you will know that whether you have to, the patient is at a low risk, high risk, or medium risk. And once you have decided that your patient is at medium risk or high risk, then you will give some recommendations that, okay, these are the things that you will be doing. So you do not need to actively calculate the must score as such. So you do not need to calculate the BMI or the percentage of weight loss, but you will have to give the recommendation after you have figured out that what exactly is the must score of the patient. Same is with the PHQ-9. So you will not require to ask all those 9 questions to the patient. Those will already be circled for you, or those will already be marked for you. But what you are going to need to do is that you will need to add that score, and then you will be provided a key as well. And as per the key, you will have to decide that whether a patient is in mild depression, major depression, or like moderate kind of depression. And depending upon that, you will have to give your recommendations. And along with that, in all 4 scenarios, you will have to take a holistic history of the patient as well. Now, that holistic history will include your history of past medical conditions, your drug history, you will take the family history, the social history, the spiritual history, and if necessary or if relevant, then the sexual history as well. So these are all of the things that you will be doing when you do an assessment. Is that clear to everyone? Now, as we will go along, we will think and we will discuss about what you do when you are taking blood pressure, how do you take the pulse, and all that kind of things that we are going to be discussing. So that we will do as we go along. So I'm going to be now assessing, and please, the names that I'm saying, if you all can just write down that what you are going to do and then can just follow the lead, then that is going to be very good. So James, you are at the topmost on my screen. So you are the lucky one to do the introductory 6. So you will be doing the introductory 6. Rhoda, you are going to be doing the A and B of the A to E assessment, which is the airways and breathing. And Regimol, you will be doing the circulation. Tisha, you will do the disability. And Kiran, you are going to do the exposure. And you are also going to take past medical history. And Pradeep, you are going to take the rest of the history of the patient. And Blessy, I think that I'll ask you to do the closure of the station. Okay. Now in this one, we'll need one person to do the news chart as well, because after we have taken all of the readings, so I will tell you that what are the readings. So as you are going to be saying that I have taken the blood pressure and pulse, so we will note down what the readings are. And Ritu, you are going to be telling me what is the news score of that patient. Yeah. And what is your what is your frequency of monitoring, and whether you are going to be escalating or not. So when I will be telling you that what is that particular vital sign, you will note all those things down and you are going to be telling me that one. Okay, so is that clear to everyone?
Yes, ma'am.
So I have not noted it down, considering that all of you would have noted down, and please, one after the other, you can carry on. Yeah. So I'm going to be sharing my screen, and then we can move forward. Okay, can you see my screen?
Yes.
Okay. So the first person, James is the first person, I think. So you will get, I'll give you a few minutes, couple of minutes to read the scenario. Yeah, and after that you can start. And please, the rest of you, can you please mute yourself? So whenever you are ready, James, you can start, and I'll be your patient. Has everyone read this page?
No.
So you are in the exam as well. You are going to get this as a scenario, as the candidate briefing, where they are going to be telling you what exactly you require to do. Yeah, so you can see that they are saying that you will need to do a holistic assessment, A to E assessment of the patient. You will need to calculate a news score, and that you are going to be getting 20 minutes to do that. And they will also tell you that you have to assume it is today and it is 10 o'clock in the morning. After that, you are also going to be having this kind of a history about the patient. So you can have a little read through this one. Okay, so James, whenever you are ready, please start.
Hello.
Hello.
Yeah, okay. And so I've entered the room safely. I mean the bay. I
Okay.
have practiced, my hand hygiene using the 7 steps in hand hygiene.
Okay, so can you show me the 7 steps?
Okay, so
Okay. Yeah, I can't see you properly. Can you just put your camera? Yeah, that is much better.
okay, I
Okay.
don't. Okay, so palm to palm,
Back.
back, and palm.
Yeah. So
Then,
fingers interlaced.
yeah, the palm fingers interlace. Yeah.
Fingers interlaced.
Yes.
Fingers interlocked.
Interlock. Yeah.
Yeah. Then
Thumb.
rotation of the thumb.
Okay, and then.
Tips of the finger.
Sorry. Yeah, tips of the finger here.
And your wrist.
Yes.
Okay.
So, hello, Miss Porter. Good morning.
Hello.
Please, I'm Nurse James, and I'll be taking care of you this morning.
Okay.
I'll be conducting an assessment on you.
Okay.
Please, may I know your name and date of birth?
Okay. My name is Ash Potter, and my date of birth is 1/1/1950.
Okay, please, let me see your wristband. I need to check something.
Okay, so there's my wristband.
Okay, thank you. Okay, so today I'm going to do, as I said earlier, an assessment on you, and I'm going to need some few information from you. So please, am I quick to go?
Yeah, that's fine.
Okay, please, do you have any allergy?
No, I'm not allergic to anything.
Oh, okay, thank you very much. I'm going to prepare and I'll be in some few minutes time.
Okay.
Thank you.
Fine. So, well done for the first attempt. Yeah. So there are a few things that we have figured out in this one. So you need to obviously, and not just you, but everyone will need to do, make sure that you practice on your hand hygiene, because it is very, very important that you are able to do all the 7 steps of hand hygiene. Yeah. Also, if we follow the introductory 6, as we had done, as I had shared with you. So in the introductory 6, the first thing that we are doing is that we are checking that, yes, the room is safe for me to enter, which you did. And you did say that I'm entering the room safely. And you will say that there are no trip hazards, no wet floor, or nothing that can be unsafe for you.
Okay.
Sometime in some scenarios, it is possible that the examiners might have given in your history and written as well that patient is nil by mouth. Now, that is also kind of a safety thing that you have to take into account, that patient is nil by mouth. And if there is a jug of water or something kept near the patient, then you have to remove that. Because you know that patient can accidentally drink it, and patient has to be nil by mouth. So that is also a safety feature. So you have to be aware of all those things. Once you have assessed your surrounding and you know that it is safe for you to enter, you are going to enter. And before you approach the patient, you are going to be doing your hand hygiene by the way that we just demonstrated. After that, you are going to be introducing yourself. So as you did, so you will tell that, okay, I'm James, my name is James, and I'm one of the nurse who is working over here, and I will be looking after you today. Yeah. After that, you are going to be checking the patient's ID. Now over here, you did ask me to see the wristband, but you did not do anything with the wristband. So it is not, you are not going to just see it. You will have to check that whether my wristband also says the correct thing as my records are saying. So
Okay.
you will be asking the patient that, can you please tell me your name and your date of birth? And patient is going to tell the name and date of birth. And then you are also going to be asking that, or is it okay if I check it with your wristband?
Okay.
So when you are checking your name and the date of birth of the patient, please make sure that you are comparing it against this sheet that you get. Okay, so you have to, the patient's details should be matching with this sheet that you will be provided.
Okay.
So, and the same information should be there on the wristband of the patient. So you are going to be checking three things: the name, the date of birth, and the hospital number.
Okay.
Once you have checked the wristband and you had confirmed that, yes, I can see that your wristband is also correct and my notes are also correct, and you have verbalized as well. So that is like the three-way ID check that you have done. After that, you are going to be checking for allergies, which you did, and the patient said that I'm not allergic to anything. So at this stage, you should say to the patient that I can see that you are wearing a white wristband, which is fine. And it is also there noted in your records that you are not allergic to anything. So that's good. Then you can move on to your purpose setting, that why you are over there. Now, when we are setting the purpose, you already know that why this patient has come over there, what is wrong with this patient. So it is always a good idea to include a little bit of the history. So you can say that I can see from your records that you had surgery done around 10 days ago, and that there is some issues going on with that, and you are having some problem with the surgical site, and for that reason you have come over here. So now I'm here to assess you, and to do during this assessment, I will be taking some vital signs like temperature, blood pressure, pulse, etc. And I'll be doing my assessment from A to E assessment. Is this a convenient time? Are you okay for me to go ahead? Yeah. So this way you have told the patient that what exactly you are going to be doing. And then you have gained the consent from the patient. Okay, so you know that how when we are trying to gain consent for something, we need to explain what are we going to be doing. Only then the patient can give a consent. So just give a little bit of things to the patient that what exactly are you going to be doing. Fine?
Okay.
Is that clear to everyone? So that is how we are going to be doing our introductory 6 till we have established the purpose.
Okay.
Okay. So now that we have established the purpose and we have said that we are going to do the A to E assessment, we move over to Rhoda. So Rhoda, you are going to be doing the A and B. Unmute yourself. Please unmute yourself.
Okay, I go on now to prepare my equipment for the next stage. Ash, I will be back in the next few minutes.
Okay.
Assessor, please, can you confirm if my trolley has been cleaned in the next few hours?
Yes, so all of your equipments are clean and calibrated. So
all right, thank you. Then I put on my face mask, I put on my apron, then I perform my hand hygiene, palm to palm, back of the finger, finger interlace. Finger. All right, I take my equipment to my patient's side. Hash, I am back. Are you okay?
Yes, I'm fine.
Are you all right?
Yes, I'm all
good.
right.
Oh, fine. That's very good. I am back with all the equipment and I want to carry on with the assessment as I explained earlier. First of all, I will start with hair. Hair is to talk about your airway. I can see you are talking to me clearly. Your voice is very clear. There's no sign of any airway obstruction. Am I right, Hash?
Yes, that's fine.
All right. So now we'll have to check your breathing. I can see you are breathing easily. You are not using any accessory muscle in breathing. There is no stridor. and there's no kind of reason. So I can say you are breathing very okay. So, but I would like to check your respiratory rate. So I will do this in the next 1 minute. Ash, are you okay with that?
You're not going to check the respiratory rate at this stage. Yeah. So at this stage, we are only going to do airway and as you did, and the breathing. So in the breathing, as you said that the accessory muscles and those, and you are not looking like short of breath. So we are only going to over here. The reason we don't want to do the respiratory rate over here is that if you tell someone that I'm checking your respiratory rate, it is quite possible that they will become conscious and the respiratory rate is going to alter. So you are not going to do the respiratory rate at this moment. You will tie it up with the pulse, which will come later.
Okay.
Okay, so who was doing C, circulation? Thank you, Rhoda. That was nice. So
thank you.
The next person.
Hello.
Who is supposed to do the circulation? Yeah.
Hello.
Yes.
Can I continue?
Yeah. Hello. Yes, Regiment. Yeah.
Now I am going to check your circulation. Can I continue?
Yes, please continue. Yeah.
First, I am going to check your BP. Do you have any preference?
Sorry?
Do you have any preference for checking your BP?
No. Do you want, are you asking for any arm preference? You can go in any arm. You can use my right arm. That's fine.
Okay. I can't see any sign of infection or swelling in this arm, and there is no cannula. So this cuff is fixed to your size and take to percentage of your arm. And I will put this 2 to 3 inches above the antecubital fossa. Now I'm going to put the cuff, and when I am inflating, you may feel some pressure, but don't worry, it's just for 2 seconds. When I'm deflating, it will reduce. Are you okay for that?
Yeah, that's fine.
Okay, now I am going to check your BP. With that, I will check your saturation. Can you give one finger for me? Okay. Before that, I will check your capillary refill. I can't see any varnish or any artificial nail, so I can use this finger for checking the capillary refill. For that, I will check, press your fingers 2 to 5 seconds. 1, 2, 3, 4, 5. So I completed. The color change will come back within 2 seconds. So that means your capillary refill is normal. Next, I am going to check your saturation. Now, for that, I will put the pulse oximeter into your fingers. Are you comfortable?
Yeah, that's fine.
Okay, now it's finished and your saturation is 97, it's normal, and your BP is 100/60. So now I am going to check your pulse rate. It will take full 2 minutes. In between, you don't talk to me. I will also not talk to you. It will interrupt the value. So now I am going to check your pulse rate.
Okay, so you consider 2 minutes are over.
Okay, Ash, now first 1 minute I will check your pulse rate. The pulse rate is 74. It is normal and regular, good volume. Now next 1 minute I will check your respiratory rate. Before I didn't tell you, because if you are concentrating on your breathing, it will interrupt the value. That is the reason I didn't tell you. Sorry for that. Your respiratory rate is 20. And I can't see any pallor or perfusion. So yeah, now I completed my assessment.
Okay, thank you. That was very good, Regimol. So it was excellent. Only one thing that you missed on that one was that when you are checking the blood pressure of the patient, you will need to ask the patient to relax and uncross their legs. Yeah, that was the only thing that you missed, but otherwise you did it very well. And well done for describing the pulse with rate, rhythm, and volume. So whenever we are describing the pulse, we have to describe it, the rate, the rhythm, and the volume of the pulse. Okay. So Ritu, I hope that you have taken all the values. You have written them down?
Yes, ma'am. Yes, ma'am.
Okay, good. So the next person who is going to be doing D, the disability.
Tisha?
Yeah. Tisha, you are doing disability?
Yes, ma'am.
Okay. So why are you okay to turn on your camera? Tisha, I think that you are on mute. So please unmute yourself and turn on your camera and you can start the disability.
Hi, ma'am. Can I start?
Yes, yes, please start.
For your disability, I'm going to check your level of consciousness. Is it okay for you?
Yeah, that's fine.
Do you know where you are?
Yes, I'm in the hospital.
Okay. What is the time now?
It's morning around 10 o'clock.
What day is today?
Yeah, today is Tuesday.
Okay. Do you know who I am talking with you?
Yeah, you are the nurse.
Okay. I can confirm that you are alert and oriented.
Mhm.
Do you have any, do you have
Yeah,
Do you
go
have
ahead.
any my difficulty to pass urine?
No, I'm okay. I don't have any issues passing urine.
Are you diabetic?
No, I'm not diabetic.
Okay, I confirm that you are very alert.
Yeah. Okay. That's good. So now that as Tisha has done, and you did very thorough checking of a patient is alert and oriented, so that was great. So as we in the disability, what we are trying to figure out is that whether the patient is alert, oriented, and that they are not having any pain. And there are a few other things as well that we will want to check. Anything that can make the patient drowsy or can have some effect on their alertness. So those are the things that we also will need to check to get a negative history. Now we know that the pain is one of the things, like if I'm in extreme pain or like is there quite a lot of pain, then that can affect my alertness level, that can make me a little bit confused and think if I'm in quite a lot of pain. So
Okay,
you will
ma'am.
be asking the patient if they are in any pain.
Okay.
If
So
the
you're-
patient, yeah. You want to say something, Tisha?
No, it's all right.
Okay. Yeah. So if the patient says that I am in pain, and that is something that I can tell you that for any of the scenario and any of the time, whenever you are asking about the pain, you should always follow it up with the pain scale. As soon as I say that, yes, I am in pain, always check that, okay, can you rate your pain on a pain scale where 0 is no pain and 10 is the worst pain. And you get the pain scale from the patient. Then once you know the pain, then you are also going to ask about if there is any possibility of a urinary tract infection, because you know that if anyone is suffering with urinary tract infection, they can be confused and they can be disoriented because of that. So as Tisha asked about that, so that was very good. So you asked about it and I confirmed that there is no problem in that one. Then the third thing that can cause the drowsiness or confusion, and that is your hypoglycemia. And for that, you need to know that whether the patient is a diabetic or are they on insulin, because you know that patients who are on insulin are at high risk of getting hypoglycemia. So you will take a negative history for that as well. And then we are also going to take a history of alcoholism, because you know that if the patient is under the influence of alcohol, then it can also cause the confusion or drowsiness, or the patient might not be in their full capacity. And then the last one is about the medication. So you need to also ask about if the patient is taking any medication which might have a side effect of drowsiness. So these are all of the negative history that you will need to take, and you need to mention, because these are all of the things which can affect the ability of the patient or which can make the patient disabled temporarily. Okay. So Tisha, did you get that?
Yes, ma'am.
Yeah. Okay. Well done. So the next one, who is doing E?
Me, ma'am.
Okay. Kiran. Yeah. So please continue.
Hello, Miss Porter. Now I will be going to check your temperature, pulse, blood pressure, and respiration rate. Is it okay with you?
So you have the pulse, respiratory rate, and everything else has been checked. In exposure, it is only going to be temperature.
Okay, fine. I'll be checking your temperature. Is it okay with you, Miss Ashwater?
Yeah, that's fine. You can go on.
Okay. The temperature is normal for you. It's just 37 degrees Celsius at the normal body temperature. So
how much
now
is
I
it?
would
Can you please repeat how much is it so that Ritu can note it down?
Ma'am, it's 37.6 degrees centigrade.
Okay.
Now, Miss Porter, I would like to check if you have got any bruises on your body.
No, I have not had.
Do you have any rashes?
No.
Any injuries?
No, I don't have any injuries. The only thing that I have is the surgery. Because of the surgery, I only have that wound.
Okay, thank you for the response.
Mm-hmm.
So as I can see in your past medical history, there is that you had a broken arm at the age of 8. Is it right?
Oh yes, I was very little at that time, so I was only 8 years old.
Okay. So I can also see that there is a history of hypertension since 2005. Is it right?
Yes, I do suffer with hypertension, but I'm taking some medicine for it, and it's under control, so it is all good.
Okay, thank you. So were you diagnosed with glaucoma as well in 2017?
Yes, and I'm on medication, so even the glaucoma is under control.
Okay, thank you for the response, Ms. Ashporter. It was nice. Thanks for the response.
Okay, so thank you, Kiran. So that was good, and I think that you did it very well about taking the exposure history by asking if the patient is having any rash or anything or any bleeding or any bruises or anything of that sort. So which is good. Then that is what is a part of the exposure. So the other part of the exposure is taking temperature. So when we are taking the temperature, we have to tell the patient that how we are going to be taking the temperature, because nowadays we are using the infrared thermometers. So you have to just warn the patient that, okay, I'll be bringing it near your forehead to take the temperature. It is not painful or nothing. Patient is not going to feel anything. And you are going to take the temperature and then record the temperature or note down the temperature accordingly. So that was good. And you took the past medical history as well. Now, when I think that when you are approaching the past medical history, so you know that you have now, after you have done the exposure, that you have concluded the A to E assessment. So it is always a good idea that you can tell the patient that, okay, that is great. So now I have completed my A to E assessment. So I will now be taking a little bit of an history to make sure that I have got a full background so that we can look after you in a better manner. Yeah, and then you can go on taking the history. Now, although we are going to be filling the news chart at the end, or maybe Ritu, if you are ready, you can tell me the news chart, news score now, because this is the time after you have done your A to E assessment. This will be the time when you will be completing your news chart and you will be telling the news score to the patient.
Okay, ma'am. So Ash Porter, after filling the news chart, your news score is 2. That means we will re-monitor you every 4 to 6 hourly, and we will see if there is any condition worsening or any deterioration in your health.
Okay. So are you going to be escalating the care?
No, ma'am.
So why are you not escalating the care? And what are the parameters in which you have got the score of 2?
Ma'am, in BP, I got the score 2. The systolic temperature was 100, while the rest of them was all normal. So I got 0 in everyone. But I will escalate if there is, in a single parameter, if there is 3 score or the score is more than 4.
Okay. See, escalation is something that you have to, it is kind of a tricky one, because you will have to understand that if now in this one, if the patient is blood pressure is 100 by 70 or what, 100 by 60.
Yes, ma'am.
Now, if you will see that it is not 100 by 60 is not a normal sort of
Normal,
pressure.
because the patient was having hypertension and the patient was taking medicine. Yes, ma'am.
Yeah, so it is patient is now going, actually the blood pressure is falling, because you would expect that this blood pressure is going to be high because patient is hypertensive, but over here you are seeing that actually the blood pressure is low. Now
Yes,
you
ma'am.
also know that this patient is suffering with this patient is suffering with this wound where there is some exudate, so patient is having some kind of an infection which is going
Infection.
on.
Yes, ma'am.
So if there is infection and if the blood pressure is going low, yeah, so that is something that should ring alarm bell in your head, that okay, this is something is not right. Yeah, so actually you would be escalating the care in this case, because you feel that there is something or some senior person also needs to have a look, and you need to the patient needs to be assessed again. Yeah,
Yes, ma'am.
so I think that in this case you will escalate. But say if 100 by, if we are in this situation that patient was not hypertensive and the patient was not having any wound either, yeah, and then the blood pressure is coming 100 by 60, but your score is still coming as 2.
Yes, ma'am.
Now in this case, then what you should do is that you should ask the patient that okay, what is that your normal blood pressure? Because there might be some people whose normal blood pressure might be below or around 100 110, yeah, and that might be normal for them. So if you have established that the patient says that actually my blood pressure is always around this, and I have had it checked before and it is always around 100, in that case you can say that okay, everything else is looking normal, your blood pressure is slightly on a lower side, but you are saying it is normal, so I will be just checking again after an hour or after 2 hours to see whether it is still falling or whether it is staying all right. At the moment you are not going to be escalating, but you will keep a close eye on that one.
Yes.
Or you can say that yes, I am going to escalate, so even though it might be normal, but I still want someone else to have a look at it and see that if we need to do anything about it. Okay, so
Okay.
when you are deciding about escalating or not escalating, you need to give a very good reasoning behind it, that why you are escalating and why you are not escalating. Fine, but otherwise the score is right, and as you have your monitoring frequency is also right, that you are going to be monitoring every 4 to 6 hourly, because your score is falling from 1 to 4. Now over here I want to tell everyone that please be aware that if your score is 3 in any single parameter, then your monitoring frequency is going to become an hourly monitoring frequency. Okay, so if the forms which I have shared, you can have a look at that form, and it does have the key to that as well, and it clearly states in one single parameter, if your score is 3, then the monitoring should be hourly, even though your score might fall between 1 to 4, but still it is going to be an hourly monitoring. So please don't get confused in that one. Make sure that your anything in red, it just goes hourly monitoring. Fine. Okay, so well done. So next person, I think it was Blessy, or was it someone else?
It was me, Pradeep.
Okay, yeah, Pradeep, you are going to take the history. Blessy is going to do the conclusion. Okay, yeah, that's fine. So continue.
Yeah, so Mr. Ash, I need to ask you a few more questions so that we can plan your care accordingly. So let's talk about your nutrition. How are you eating and drinking well?
Yes, I'm fine. I am eating all right, but although sometimes I don't feel like, but it is fine. I'm managing.
Okay, that's fine. That's good. And how about your, are you opening your bowels regularly?
Actually, no, because I think that I am getting constipated and I have not opened my bowels for the last 4 days.
Oh, okay. That's fine. What I'll suggest to you is to drink plenty of fluids. That will help you as well. And then once I'm done with your assessment, I'll see if, or I'll speak with the doctor and see if they can, prescribe any laxatives or anything which will help you as well. Yeah.
Okay.
Okay, that's fine, Mr. Ash. I want to ask you more about, do you consider yourself spiritual?
Not really. So
Okay.
I don't particularly sort of follow any certain religion or any spiritual sort of routine or anything like that. So
Okay, that's fine. That's fine. And how about your, do you drink like alcohol or anything like that?
yeah, I do drink. Um, like I drink around 2 pints of lager every day. Sometime it can
Okay.
be more. Recently, because of all this pain, I tend to sort of drink a little bit more than usual.
Okay, so you're saying it has definitely increased from last some time, yeah?
Yeah,
Oh,
although I hate to admit, but yeah, it is a little bit more than usual.
okay, okay. How about smoking? Do you smoke?
No, I don't smoke.
Okay, that's good. That's good. All right, Mr. Potter, I wanna next I wanna ask you, from your records, I have seen that you was living with your wife, and now you're living on your own. So how are you coping on your own? How are you managing?
Yeah, I'm sort of just ticking on, but like my son or my daughter or my son-in-law, they visit every other day and get me some food.
Okay.
And I'm managing just with that, although it's not nice to be alone, but yeah, I am sort of managing, but I do feel a little bit low at times.
Okay, so have you tried like distracting yourself by reading books, watching TV, and all that?
I'm not very fond of reading books.
Okay, that's fine. Um, I think that's it.
Also, because of I'm not able to cook and do all those things because of this wound, I'm not able to walk properly. I used to walk easily before the surgery, but I'm finding it so much more difficult now because it keeps on hurting and now it has started oozing. So I hope something can be done about it.
Okay, that's fine. Yeah, we'll plan your care accordingly, and we have taken notes of that as well, and we'll see what we can do for that.
Okay, so thank you.
Yeah, thank you.
Okay.
I'll say that's it.
Well done, Pradeep. So I think that when you are asking about the history, a little bit of the history was asked by Kiran. So he had already done the history of the past history, the medical and the drug history he has already done. And
Yeah.
now we are checking about the next lot of the history which you have taken. So you have asked about the social history, you have asked about whether the patient is drinking alcohol, smoking history, and also whether the patient is managing eating, drinking, going to the toilet, constipation, all those things that you have asked. So it's fine. This is, and you have asked about the spiritual history as well, so which is absolutely fine. So you have concluded majority of the history and you have taken a sort of well-balanced history. You can what you can one of the good thing or what the trick that you can use is that sometime it might be a good idea to ask the patient that, okay, is there anything else that you would like to add, or is there something that I have missed asking you, please? So in that way, like if there is anything else which is of importance, or if sometime the patient wants to tell, then they will be able to tell you that thing. Yeah, so always give a chance to the patient as well, that if there is anything else that they feel is relevant or important and they want to tell you about.
Okay.
Fine. So well done for that.
Yeah.
Now the last
Thank
one.
you.
So let us conclude it.
Yes, ma'am.
Yeah.
So, Mr. Asha, are you feeling comfortable?
Yeah, that's fine. I am okay. I think that I will feel much better after something has been done with my wound, but at the moment I'm feeling all right.
Okay, that's fine. So I have completed my task, and then now I am going to take away all my articles and I clean and keep them ready for next week. And I am also going to update your record. So I am going to place a call bell near you. If you want any help, you can press the buzzer and I will be here. And I'm opening up the curtain and see you soon.
Okay, that's good. And before you leave, you will do your
Hand hygiene.
final hand hygiene. Yeah. So that's good. So that is the conclusion. And I think like how we have discussed about opening of every station with introductory 6, I think that we should all also have a plan of the closure, because each and every station you will have to close that station as well. And for all of the stations, if you can get in a habit of saying all these things, that yes, you have concluded your task, and now you are going to be taking away all of your articles. So you are going to be taking away all of your the articles that you use to check the blood pressure, the temperature and all that, and you are going to make sure that they are stored properly, they are cleaned for the next use. Yeah, and if there is anything that you need to discard, then you are going to also say that I will be discarding it appropriately in the clinical waste bin. And then you are going to be taking off the, you will ask the patient that if they would like to have the curtains off, or if they like the windows opened or something, that you are going to take off the privacy. You will also check with the patient that if they are comfortable, if there is anything else that you can do before you leave, if you can get them something to drink, as long as they are not nil by mouth. And then you will also tell them that there is a call bell near them, and if they require any help or assistance, they can always use the call bell. And with that, you are going to do your final hand hygiene. You will say that now you are going to be updating all of the documents, and then you are going to thank the patient and leave. Okay, so just remember all these things. So because you will need to get in a habit, because remember that when you are opening your stations, you have plenty of time, but during the closure, you are running out of time. So you might hardly get 30 seconds, 40 seconds to close your station. So it is going to be a good idea if you know that what all things you have to verbalize, what all are the important things that you have to say. Fine. So any question anyone has in this news assessment that we have done? Yes, Pradeep?
Ma'am, I just want to ask you basically regarding, you know, how we do temperature during exposure, was it? Yeah.
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 Exposure.
So can we do, yeah, because can we do, just a question, can we do like a temperature with while we doing like BP and all that? And can we get done with it or no?
Yeah, see, you can do it. And there is no hard and fast rule which is saying that you can only do things in this sequence. Yeah, there is no hard and fast rule like that. But it is always a good idea that because you are doing an A to E assessment and you are trying to show the examiner that you know and you are going in a planned manner, especially for the exams, it is going to be a good idea that if you follow the A to E sequence, you can do the temperature at whatever time. It is not, as long as you have got your temperature done, it is no one is going to fail you for that one. Yeah, but yeah.
Yeah, it's certain. It's just like I don't know, because if I leave it to like exposure, for some reason I think I'm gonna forget it. I don't know why.
But if you do A to E assessment, and if you keep on saying each time that okay, I have done A and E, now C is the circulation, so I've done this circulation. Now I have done the D for disability. You have done the disability, and now I'm coming to E, which is the exposure. So in that case, you are not going to forget. Yeah. So try and practice it in this way. But if you feel that, okay, even after practice, you are kind of forgetting, then you can take the temperature at that time. But you can say that I will, while I'm at it, I will also take your temperature, although it is part of E, but I'm just going to take the temperature now itself. So you can say that and take the temperature.
Okay, that's fine. Thank you.
Yeah.
Yeah.
Okay. Any other question? Okay, so if there is no other question, then we are going to be now quickly go through the GCS must and the PHQ-9. Now, whatever we have already repeated, whatever we have already done, I'm not going to be repeating that thing. So for GCS, we will start from that for doing the GCS and then going ahead with so we will calculate the GCS and then we'll skip the A to E assessment and then we'll go to the pupils and all those things. Yeah. So who is going to be doing the GCS? Let me see. Helena, do you want to do the GCS? So we are going to be saying that the patient is like, let us take the history that there is this patient who has had a fall when she was going to her workplace, and she was riding a bike and she had a fall. And after the fall, she hit her head and has got a head injury. And she has been brought into the A&E. Now, patient is otherwise awake, but you are supposed to do an assessment on the patient to check the GCS and also the neurological assessment. And you have to complete the GCS chart. Okay. So, Helena, are you okay to do the GCS part of it? Okay, Helena is not listening. Pema, why don't you do it? Pema, can you hear me? Yeah, are you okay to do the GCS?
Yeah.
Okay, that's great.
Yeah. Okay.
Okay, so
Oh.
yeah, please continue. You can take the same name for the patient. Patient can still be Ash.
Okay, so I'm going to start. Now I'm entering the room. The room is safe to enter. There's no trip hazard and wet floors. So I'm going to do my hand hygiene. 7 steps of hand hygiene. Palm to palm, back of the fingers, palm to palm with finger interlace, knuckles, and rotational of the thumb, tip of the fingers, and the rest of the thumb. So, hello, Mr. Ash Potter.
Hello.
I'm your nurse, and I'm here for your I'm here. I'll be looking after you today, and as I can see from your record that you had an road traffic accident while you're coming for your job. So as I can see, you had an head injury. So I'm here to make an assessment on you. So if you're okay, let me know. So are you okay with
that's
that?
fine. Yeah, it's all right.
Okay. So first, let me confirm with your identification. So what's your name and date of birth, Mr. Ash
Yeah,
Potter?
my name is Ash Potter and date of birth is 1/1/1950.
Okay. Is it okay if I check with your wristband?
Yes, that's fine.
So I can see that your name is Ash Potter and your date of birth is 01011950 and your hospital number is this.
XYZ.
So yeah, XYZ. And yeah, so okay. So I have to ask you a few questions to know about your consciousness level. So if you're okay, I will start my assessment here.
Okay.
Okay, so first I will start with my simple questions. Do you know, Mr. Potter, that where are you currently? Where are you?
Yeah, I'm in a hospital.
Okay. Do you know who I am?
Yes, I know you are the nurse who is looking after me.
Do you know what time of the day it is?
Yeah, it is around 10 o'clock.
Okay, so now I'm going to check your pupils. So for that, I will need your cooperation. I want you to see straight so that I can check your pupillary reaction. I will be lighting up a torch in front of your eyes, so it will be a little bit of discomfort for you, but if it is more, then please let me know.
Okay.
So I'm going to check your pupillary reaction. And here for the left side. So as I can see, your pupils is 2 millimeter in size and it's fully reacting to light. Okay. And yeah, so next part I'm going to assess your motor response so that I can know if you have any disability following the road traffic accidents. If you're okay, shall I proceed?
Yeah, that's fine.
Okay. Can you please raise your hand?
Mm-hmm.
Any of your hand? Yeah, that's good. What about your legs? Can you raise it?
Yeah, I'm able to.
Very good. Uh, now, wanted to see if you can flex your hand like that. Can you show me flexing your hand? Yeah, good. Very good. Then your legs, please. Can you flex your
Yeah,
leg?
I can do that.
Thank you. Yeah, so I can see there is no any abnormality with your motor response. You don't have any mobility disability in your after this accident. So I can see it's good for you. Uh, yeah, so that's all. And thank you for cooperation, Mr. Potter. Is there anything you want to ask or if you want to add on this assessment?
No, that's fine.
Okay. Thank
Okay.
you. Thank you for cooperation.
Thank you very much, Pema. So that was very good. So you did the full neurological assessment. There are a few things which I would like to add in this one. So just to so when you did your you started with your introductory 6. So please make sure that you ask for allergies as well. So you missed the allergy. So now just make sure that you go according to the introductory 6 and you have done the allergies. Now, when we come to the stage that when we are setting the purpose of our visit, yeah, so it is, and I keep on telling you about the purpose of the visit because actually it is very important that when you are setting the purpose of your assessment or your what you are going to be doing, it is very important not only for you to tell the patient but also for to tell yourself that what are you here for, that what is your task. Okay, so it is important that you set the scene with your purpose. So you will be telling the patient that I have read from your history that you had a fall and that you injured your head. So although you are looking all right at the moment, but in order to make sure that you have not sustained any injury, so I will be requiring to do a GCS assessment and a neurological assessment. Yeah. So for that, I will be, and along with that, I will be doing an A2E assessment as well, in which I will be checking your temperature, blood pressure, and all those things. So is it convenient and is it okay for me to go ahead? So you have explained what you are going to be doing and you have set yourself the target as well, that I need to do the GCS, I need to do the A2E assessment, and I need to do the neurological assessment of the patient. Fine. So now the first thing, and that is the reason that I have brought up this chart so that all of you can have a look. So it is always a good idea that we should always follow the chart, that how the chart is going. And if you see the news chart as well, you will see that news chart is also from A to E that they have done. So it is always a good idea that we follow the chart, that how it is going. Now, in this chart, which is the GCS chart, you can see that the first thing is the GCS or the Coma scale, Glasgow Coma scale, that you will need to complete. So Glasgow Coma scale is very, very easy to sort of do because you have been talking to the patient. You have checked the patient's name, their date of birth, patient have told all of those things. So while you were doing all of these things, you have already made this observation that the patient is opening their eyes spontaneously. Yeah. So if the patient is talking to you, they are looking at you, so their eyes are opened. So you can comment on that. That I will be doing, the first thing that I will be doing is the GCS, which is the Glasgow Coma scale. So as a part of this, my first thing is to check your eyes. So, and I can see that you are opening your eyes spontaneously. So we can say that, okay, we are going to give the spontaneous eye opening as full marks. Then the next thing is your verbal response. So you want to check that whether the patient is oriented or they are confused. So you check that one by asking the patient that where they are, who you are, and what time it is. So you have checked, the patient has told about everything, all right. They said that they are in the hospital, you are the nurse, and you told about the time. So that means that they are oriented in time and place. So you can give them the full marks for that one. So you have given them the marks for that one. And then you are going to be asking about the third thing is the best motor response. Now, best motor response means that you need to check that whether the patient is obeying command or not. Yeah, so you can ask the patient that, can you please lift up your arm? If the patient lift up their arm, or you can ask the patient that, can you look up? Can you raise your eyebrows? So you can ask any of those things, and patient can do that thing. And if the patient is obeying your command, then you can give them a 6 over there. So you have done your GCS by just asking these few things. And you can see that the GCS of the patient is 15 out of 15. Now in the exam, sometime it is possible for the examiners or for the actors who are being patients, so they can say that they can be appearing as confused. When you ask them this question, that do you know where you are, they might say that, oh, I think that I'm in the clinic, or I think that I'm in my home, something like that. So that means that they are slightly confused, they are not oriented to time and place, and in that case you will have to give a 4 for that one, and that your GCS can come down to 14 over there. It will be highly unlikely that you are going to get the GCS below 14. So it can be either 14 or a 15 GCS in the exam that you are going to get. Is that clear to everyone?
Yes, ma'am.
Yeah. So
Yes,
now
ma'am.
you see on the right hand side of this chart, they have written something like eyes closed by swelling. So you can write C, or if verbal response, if the patient is having tracheostomy or endotracheal tube is there, then you will write a T over there. Yeah. So sometime what happens is that I had a fall and I banged my forehead, and because of that, my eyes are swollen. Yeah. So because my eyes are so swollen, I cannot say that whether I'm spontaneously opening or not opening. Yeah. So that is why in that case, I'm just going to write a C, which will tell me that I cannot check it because the eyes are swollen. And the same thing is also going to be for pupils as well, because if my eyes are so swollen that I can't see the eyes, I can't check the pupils as well. So I will be writing the same thing for the pupils as well. Okay, so once you have done this GCS, then you are going to do your A to E assessment. And as per your A to E assessment, you are going to be noting your temperature, your blood pressure, pulse, respiratory rate, everything in this section. So say if the respiratory rate of the patient is 18, so you can write down, or you can put a dot over there. So over there you have put, if the patient's pulse is in between 70 to 80, 72, then you can put it over there. You can put the pulse over there, and for the blood pressure, you are going to be writing a line, you will draw a line over there. Now over here, you have to see one more thing, which is of importance. If you will see the temperature is on the right hand side. Now that does not mean that you will have to come and mark the temperature on this side. All that means is that because this side, they did not have any space to write the temperature. So they have written on this side. So if I say that the temperature of my patient was 37, then I'm going to drag this line over here, and I will be marking I'm just marking with the cross. Oh, sorry. So I will drag the line over here and I will mark it at this place. So in reality, actually, I will be marking it over this line, but I can't mark it over here. So if I say the temperature is 37.2, so then I can mark it over there. Okay, have you understood that one? That how we are going to be marking?
Yeah.
Yeah?
Yes, ma'am.
Yes, ma'am.
Once you have done that, then as Pema had said that you are going to be checking the pupils. So when Pema checked the pupil size was 2, and they were reactive on both the sides. Then normally we are going to say the size of the pupil normally are 3 or 4. So, but it's okay. If we are saying 2, then we are going to be writing 2 over here. And for reaction, we are going to be writing a plus. And that is for the right side. The same thing we are going to do for this one as well. So we'll write a 2, and we are going to be doing a plus for this one. Yeah. And then we are going to be checking the limb movement or the power in the upper limb and the lower limbs. So when we are checking the power, now when we check anyone's power, yeah, how do we check it? So we will see that whether the power, like if I'm able to resist. So I will ask the patient that you put your arms forward, your hands forward, and that I'm going to be pushing your arm down. Don't let me push. So that was going to give me a good idea that whether I'm able to easily push it down or I'm not able to push it down. So if the patient is able to resist it, then I will say that yes, the power is good. But if the patient is not able to resist and it falls down very easily, then I know that there is some weakness over there. So I'm going to be checking in the arms and in the legs by doing the same test. So if we say that I did the upper arms and the power in the upper arms, both right side and left side, it comes back as normal. Yeah. Then in this box where it says normal power, I'm going to be writing R and L together because it is both of the right side as well as the left side. It has normal power. Then I go to check my legs or the patient's legs, and I realize that the right side is having normal power, but the left side is having a mild weakness. So what I do is that I'm going to write R against the normal power and L against the mild weakness, because it is the left side which is mildly weak, but the right side is having normal power. I'm also going to be concluding this chart by writing the full GCS, and I'm going to be writing the oxygen saturations over there. So that is how I will be completing my chart. Of course, you will have to write your name, your patient's name, hospital number, date and time, and you will have to write the time over here. So I was doing at 10 o'clock, so I'm going to be writing 10 o'clock over there. So have you understood that how to complete this chart?
Yes.
Any questions with GCS? Yeah, rest of the things are anyway going to be the same as what we did. So once we have done all of the GCS, then we are going to be taking the history of the patient, the holistic history like we did in the other one and in the news, and we are going to be concluding as we did it in the news. Yes, Rhoda, please ask what you want to ask.
All right. My question is, in case you have the endotracheal tube in place, where exactly are you going to put that T?
T and C.
Yeah.
So you can write in non-testable over here. So where it says not testable, because you are not able to test it. So you can write either C over there or you can write a T over here.
Okay.
Because you are not able to test it. And the reason for that is, like in that case, you are not going to write this, you are just going to write this. You're not able to test it because the reason is that eyes are closed or the patient is having the endotracheal tube or the tracheostomy.
Okay. Okay. That's fine. Thank you.
Okay. So yes, Ritu.
Ma'am, then we will leave the GCS code column blank.
Yes, you will leave that blank because you cannot complete it. Because there were a few things which you are not able to test it, and you are going to leave it blank.
Okay.
But just to sort of let you know that in the exam, it is not going to happen like that. You will, no one is going to come up with the swollen eyes or with the tracheostomy. So you will get a chance to complete it. But in the real life, yes, it can definitely happen. Pradeep, do you want to ask anything? Because your hand is raised. Was it from the previous one or do you want to ask anything now?
Ma'am, I think it was from the previous one.
Okay, so if you can just put down your hand.
But I still have one question just because. Okay. No, sorry.
Carry on.
As we are counting the GCS score, so do we have to count the new score as well? Do we gonna get two charts because we are doing the BP and everything on GCS chart also? No. Okay.
No. So that is why I had told you in the beginning as well that when you are doing the news, just news, you will just do the news. When you are doing GCS, you are just going to do the GCS because the GCS chart itself has all the place where you can fill all of the vital signs that you have taken.
Okay.
Yeah, so you are not going to be required to do two charts. Either it is going to be GCS or it is going to be the news. But when you are in the community scenario, at that time, you will have to do news plus the must explanation and news plus the PHQ-9 explanation. Because in must and PHQ-9, you don't have anywhere to record all of your vital signs. That is why you do the news along with that. Yes, Pema?
Ma'am, I wanted to ask, where shall we write the respiratory rate in this GCS chart?
Yeah, so respiratory rate is going to, see the respiration is over here.
Okay.
So depending upon where is your respiratory rate, you are going to be writing it over there.
Okay.
Yeah, so if it is between under 20, you just point out over here. If it is between 20 to 30, you are going to be marking in this column.
Thank you.
Okay. Yes, please, Udo, you want to ask something? Unmute yourself. Unmute yourself.
Okay, thank you. So I'm a bit confused about where to record the BP and the temperature. You mentioned the temperature all the way.
So temperature, I shown you that we are going to be marking it over here. So if you see, the temperature is it is given on the right side of the chart. This is the temperature. Yeah, because on the left side, there is already so many things that they don't have a place to write this one. So they have given the temperature on this side, but you are not going to be recording over here because the column that you are using is this column. So you are going to, in this case, like if we consider the temperature is 37.2, then we are going to drag it on this side and we'll see that 37.2 is falling over here and we can mark it with a cross. So that is your temperature.
Okay.
And for the blood pressure, you are going to be marking it in the same way. Say if my blood pressure is 144. So I will write, so usually the blood pressure is marked with this way. So I'm going to be putting an arrow over there. And if my 144 is my systolic and my diastolic, if I say is like 82. So I'm going to be marking it over here.
Okay.
If it is going to, actually I need an inverted one, but I can't find that one. So, but you are going to be marking it over here, and then you are going to be using a dotted line to join both of these ones. So that is how you will be marking your blood pressure. Yeah, so if you will see the recording that I had shared yesterday of how to complete the charts. So please watch that one. In that one, I have actually written and shown you that how you are going to be marking those things. Okay. So I just want to now move on quickly to the must and the news. Oh, sorry, the PHQ-9. Now in those ones, I'll just explain because we have done majority of the things. So when we go for the must or the PHQ-9, how we will do is that we know that it is a community scenario. So we will go, we will do the introductory 6. We are going to set this scene for the or our purpose. And in the purpose, we are going to be telling the patient that, okay, whatever the patient's history is, say, for example, the history of this patient is that patient was admitted to the hospital 3 days ago. But now today, 3 days ago with the history of pneumonia, but the patient has now been discharged back at home. And you are a community nurse who is required to visit this patient at home and take the vital signs. While the patient was in the hospital, they also had their PHQ-9 test done. So you will have to do the talk about their PHQ-9 as well. So this is kind of, if we take a PHQ-9 scenario, then when we are setting our purpose, we will tell to the patient that I can see from your history that you have recently been discharged from the hospital. So today I'm over here to check that you are doing all right and that your vitals are all good. So for that, I will be doing an A2E assessment and I will be checking your blood pressure, temperature, pulse, etc. But along with that, I will also be talking to you about this little test, which was with a form that you filled while you were in the hospital, which tells about how your mental state have been. Yeah, so it is going to take me around 15 to 20 minutes. Is it okay if I can continue? And the patient will say that, yes, you can continue. So after that, you are going to start your A2E assessment, and you are going to do the A2E assessment as we had discussed in the news. You are going to be completing the news chart as we had shown that how we will complete the news chart. You will come up with the news, you will come up with the score, and you are going to tell that this is the score, this is whether you are going to escalate or not escalate, and your monitoring frequency and all those things you are going to be doing. And after that, you will say that now that I have completed that, as I discussed earlier, that we will also be talking about this, the questionnaire that you had completed. So I can see that you have marked all of the answers on that. So only the answers will be marked and you are going to add up those answers. So say we have added up and your answers have come. Let me see if I can bring out the chart. So we will say that, okay, I have seen all of your answers, and your answers say that your the PHQ-9 score is 15. Yeah, so I'm just going to share the screen with you guys. Okay, so the meeting is now live on the YouTube. Where is that coming? So as we were discussing that today we are going to be doing the where is this assessment. And in the assessment, I think yesterday we had already discussed that there are basically 4 type of scenarios which can be there in the assessment. Sorry 2 are the in-hospital scenario and 2 we can say as a community scenario. The in